So as chair, I get to summarize the studies and we'll open the floor to questions soon after. So here we saw 5 different interventions and the way I see it is they are quite diverse. So we saw one unconditional cash transfer from Bangladesh, which incentivized people who were growing nutritious food in terms of horticultural produce. My sense is that that cash enabled them to retain that for self-consumption rather than sell it to the market. We saw from Samyukta in the context of crop insurance that it de-risks production and sort of incentivizing private producers to actually, and I use that intentionally because I'm going to come to that aspect soon. You're incentivizing individual farmers to diversify their crop portfolio to more nutritious crops. And then we saw Shiva Bhandari talk about an RCT, and that was a bundled intervention with the microfinance product as well as agricultural equipment. And then we saw evidence of contract farming, which actually suggested that it's a marketing come informal credit, again bundled, which actually probably pushed farmers because they were contracting in a food crop, but presumably the contracting firms were using maize for feed or for a commercial use. So there's a trade-off with crops that have both a food aspect and a commercial aspect. It in fact actually leaves them worse off in terms of food security. And the last one again was a complex bundled intervention that actually operated both on the supply side in terms of retailers as well as producers with a behavioral change component that influenced household demand. And I think one of the things that I got from all of this is they're all complex bundled interventions. And they were happening in contexts which were, it's both context dependent, but also heavily dependent on preferences. And how each community responded to that intervention is something that they have actually tried to understand through qualitative methods. So I like the fact that these are bundled interventions and you've not restricted yourselves to quantitative analysis, because it's only the qualitative that can get you a flavor of how things happened and why things happened. At the same time, I was left wanting to hear more about the channels through which these things happened. So with that, I think the other thing I wanted to add is all of them are actually, in terms of conditional or unconditional cash transfers, we always know cash transfers as a tool through which we incentivize people to change their behavior. And in all of these contexts, I think cash transfers to household have been studied a lot, but we have not studied cash transfers to retailers or producers as much. And I think one of the issues, big challenges for public policy is how do you enter the private sector space and change behavior? And I think we are going to hear more about it from the panel later this afternoon on private-public partnerships. And I think that's a big challenge in the context of dietary transition. So I leave it there. I'd like to open the floor for questions, but I'll have to stand to be able to see questions from this side. We'll collect all the questions and we'll hand it over to them.
My question is to Hassan. I would like to know the contract farming, is it for different crops or specific crop? And if it is not for specific crop, there could be farmer may be interested for dense crop in terms of nutrition, in terms of contract, or in terms of how do you control that variability in your factors affecting participating in contract farming. My second question is, do you think that contract farming for nutrition is a sustainable approach? Maybe for income could be, because the decision to participate depend on the, but for nutrition, can we consider it a sustainable approach so that to possible for scale up? Thank you.
My question is to Samyukta. During the study, did you get any data on how many small and marginal farmers have applied for the crop insurance, and how many among them have got the benefits out of that in case of there is crop failure? Also, I would like to know if there is any initiative from IFRI to influence the policy to include the small and include the sharecroppers and the women into the crop insurance program? Thank you.
Yeah, I have also a question for Sayukta. I think in India, since last around 2 years, the insurance policy is running, and I would like to know if in your sample, we have found some farmers who have benefited from insurance. Maybe, I don't know if in Haryana they are providing in case of tomato, but at least in case of cereals and like were they able to compensate their losses through the current insurance plan? If you have some cases or some example, I would be happy to know.
If more questions come up. Oh, you have one already?
I have,
Yeah.
so I have one for Shiva. Thank you for the presentation. I was wondering if you all looked at results for adults in your intervention.
So thank you for the question. Yes, we have the results for the adults, and it has been published as a journal paper already. And what we saw is that due to the livelihood intervention, we found that the intervention had improved our positive effects on the health outcomes, dietary intake, and even household food security level of the adults. Yeah, thank you.
Firstly, on a lighter note, my name is Husseini, not Hassan. Hassan is behind you over there. So actually, a lot of people have been confusing the two of us. So I think it's better I clarify that. Yeah. Thank you so much. Now to my question. Actually, the contract farming in the area I study is basically for maize. It's basically for maize crop. And then the other question on whether contract farming can be sustainable, it can. From literature, you see a lot of benefit of contract farming. However, what I realized and why I studied is that the governance, how the contract farming arrangement is managed, then farmers' orientation and training. If you train farmers to negotiate good contracts, you train them on how to study price movement, on how to bargain better, it can help. But when they are just left on their own without information and they live at the mercy of the firms are after profit. And whatever they will do to get profit, they will just rip the farmers and move on. But if you train the farmers very well, they know exactly what to do at what time. It's a sure way of lifting or enhancing welfare of smallholder farmers. Thank you.
Thank you for your questions on the insurance. To answer your question on how many small and marginal farmers, our feasibility studies for the model itself were done solely only with small and marginal farmers. So all of the results that we have on feasibility and sustainability all pertain to smallholder farmers, small and marginal farmers. And the current study from which I presented, 64% of the sample is, and the beneficiaries are small and marginal farmers. To answer you on whether we are trying to influence policy, we are trying to work with the government crop insurance scheme to see if claim settlements, at least for localized risks, so risks that cannot be captured by weather index or risks that cannot be captured by the crop sampling methods, whether we can see evidence of that from pictures and from the data that we're generating in the study. So we are trying to do that much. So for landless farmers, for sharecropper farmers, the main proof of farming, as opposed to land documentation, which is the case in the government scheme, we are providing satellite-based imagery of their plots as proof of land, cultivated land. So we are trying, but we're not there yet. It's not been offered commercially yet. And to answer your question on how crop insurance is performed, the performance of the National Crop Insurance Scheme has varied widely from state to state and between crops as well. As little as 5% of claims have been paid out in some cases, and as much as 98% of claims have been paid out in certain cases. And so it's too early still to tell if there are any trends because it's only been 2 or 3 years from when the insurance scheme was started. Did that answer your question?
My question was specific to your study area. In your cases, have you come across them?
Oh, okay. So, I mean, we have something like 9% of farmers being actually aware of themselves being enrolled in crop insurance. Of course, for tomato, it's not available in Haryana, just for wheat. We have about 9% just being aware. I'm not sure, we don't have data yet on who has benefited from insurance or not. Thank you.
So I had a couple, if I may. So Samyukta, in your work, you found that wheat per hectare profits were higher as opposed to tomato, but the willingness to pay was the inverse. And I think a large reason, I mean a big reason why that's happening is because there's a procurement system. So I think the insurance against price risk in the case of wheat is actually procurement acts as the insurance. So I think you need to factor in a little bit of that. Did you factor in a bit of that, and what are you doing to go to other contexts where this may not be the case? My second question is regarding the title of your paper suggested that there was something about the insurance that was nutrition sensitive, and that's an open case, right? Because we have evidence from here that suggests that if you produce and eat yourself with a cash transfer, you may actually be augmenting the financial incentive is nutrition sensitive. But if they are selling all of this, and like the contract farming case, they are selling all the produce, so the margins are higher, but they are not consuming it, you're going to have the contract farming case. So I was wondering how you are dealing with that. And in the case of the Bangladesh intervention, I was wondering if you were able to look at households, a control group, which had the intervention without the cash transfer. Because if the cash transfer is actually doing that job, we must, I mean, there's a lot to learn from if that approach makes a difference, because it's quite novel. I've not seen agriculture interventions with the cash transfer to the farmer. So I have these two questions for you.
I'll take your question. Thank you for pointing that out, Sudha, and it's definitely a suggestion that we'll keep in mind. So we are aware that to some extent the procurement scheme is queuing incentives in favor of wheat. We have not controlled in this particular, in the results that we shared, but what we are trying to do is now working in other states where, and with FPOs, where to some extent we can mitigate the price risk in tomato to make it kind of comparable with wheat, where there's like almost no price risk. And then for your second point about the design itself being nutrition sensitive, that point is well taken. The insurance, I think there is only a limited scope for insurance to actually have impacts on insurance. But rather we are trying to see if there are ways that we can design insurance in a way that promotes crop diversification or diversification into nutritious crops. But definitely there are several other pathways that are still there to influence, you know, agriculture from, I mean, influence what you produce and how it translates to what you eat. So that's definitely something that we are studying. Hopefully the impact evaluation will capture some of those pathways.
Our study was a feasibility assessment. It's just a tiny study of like about 100 households. And so we wanted to see whether these three components can be integrated together and whether it would be acceptable to the community. And it's whether feasible in terms of logistic. It was not our city, so we couldn't really assess each of the components. So, but this study will help us to design in our city. So that's why we did the study, to get more insight to design in our city, where we could compare different components and relationship to each other as a company.
Thank you. Any further questions? So I'm going to put this down to post-lunch sort of topper. Thank you very much, all of you, for really provocative and invigorating presentations. And I'm looking forward to seeing advanced versions of your studies or efforts because this is such an important issue. So thank you all, and thank you all for being here.